Let's talk about diabetes, more specifically type 2 diabetes. It is a chronic condition that affects millions of Americans. And now the American Diabetes Association has declared this condition an epidemic in Washington state. So I recently spoke with Dr. Rhonda Randall, Chief Medical Officer for UnitedHealthcare's commercial business. You know, this is a condition that affects so many million Americans. But let's just talk about really the nitty gritty. Tell us more about diabetes.
Yeah, diabetes is a chronic condition. It's typically characterized by the inability to regulate or produce insulin, which results in elevated blood glucose or high blood sugar. And that can lead to complications, things like kidney disease, blindness, cardiovascular disease, and more. There are two types of diabetes. Type 1 diabetes is generally genetic. It's the inability to produce insulin, and we often see it emerge during childhood. Type 2 diabetes is what we're really seeing growing in our country, very much related to lifestyle factors where the insulin it produces can't be used properly.
Let's talk about some of those lifestyle factors in regards to type 2 diabetes. What are we talking about?
So things like physical inactivity and obesity are the leading causes of type 2 diabetes in our nation. And we've seen that on the rise. And in fact, according to the American Diabetes Association, just in the state of Washington alone, you have nearly 32% of adults who are self-reported to have obesity. So we know in most circumstances that number is probably higher. And in an additional 17% who are able to be physically active, yet don't get any meaningful physical activity in a regular day.
So what can people do to reduce that risk?
Yeah, those lifestyle changes are really important, either maintaining or changing your lifestyle. So thinking about things like, what are you eating? Is your diet rich in vegetables, for example, especially the green leafy vegetables? Are you getting enough lean protein? And then thinking about moderating your carbohydrate utilization and really saving things that are refined sugars and so forth for a special treat and not having them too frequently, for example. It's also recommended that we get a moderate activity multiple times a week. So things like brisk walking, something that you enjoy and you're going to stay with, whether it's the time of year that you like to be out gardening, vacuuming the house, taking a walk with a friend. Is there a neighbor who you want to reconnect with or connect with, and you can make them your walking buddy? Things that can help your lifestyle as well as someone else's.
What happens if you do get diagnosed with type 2 diabetes? It's a scary diagnosis, but are there ways to live with the condition in a better way?
It is. And I think that the thing to recognize is that there are a lot of people who are living with this condition. So you mentioned that earlier. We know at least 38 million people are living with diabetes in our country, and another 98 million have prediabetes. So if you think about those numbers, that's more than a third of adults in our country either have or are at risk for diabetes. So managing it and living with this condition well is important for all of us. Chances are, if it's not you, you have someone in your life or your family who needs help with managing the diabetes. So making those lifestyle changes can have a great impact. I always recommend people talk to their doctor. If you don't have a primary care physician, get a primary care physician. Having that longstanding relationship around your health is really important, and they can customize a treatment plan that's right for you. So monitoring your blood sugar levels are really important. Yeah. In fact, using a continuous glucose monitor, even early on, has been more and more recommended because you're seeing what you do during the day and how it directly affects your blood sugar, in addition to some of the lab tests that your doctor will do.
What else can people with type 2 diabetes do better to manage their condition?
Well, there may be additional support out there. So, for example, talk to your employer. Most Americans get their health insurance through their employer. Talk to your employer if they have a program that might help you manage your diabetes. For example, through the Level 2 Assured Value Program, eligible employers can have those program fees often reconciled against their medical claims. It gives a tremendous amount of support to the individual who's dealing with diabetes. You're getting that continuous glucose monitor, a coach who's helping you interpret it, there to guide you around those lifestyle choices when you're taking your medications, and the questions that you might want to have for your doctor. So a program like Level 2 can really be an assistance, and that's something you might want to ask your employer about.
And for more information on UnitedHealthcare's Level 2 program with lots of resources about type 2 diabetes, just visit the website you see right there on your screen.
This portion of New Day Northwest is sponsored by UnitedHealthcare.